I've struggled with this my whole life. It just made me so insecure and life-changing. Thank you, Dr. Lebowitz.
Good morning, Dr. Lebowitz, Long Island Gynecomastia Center, Long Island, New York. So we have one case today, pretty long case. It's a touch-up case, but more than a touch-up. He had gynecomastia surgery done about 2 years ago, not by me, from another doctor. Had some liposuction, some gland, and they cut around the nipple and to lift them, and the scarring really wasn't that great, and the results weren't that great. From 2 years ago from another doctor. I'm going to show you the pictures, the pre-op pictures right now that I took when I did his chest about a year ago. So I vasored, liposuctioned his chest to about down here. Didn't touch the scar on the nipple because it really didn't need to be, and just leave that alone. It's a little oblong now from the previous surgery, but that's kind of what it is. I can cut around this one, make it more round, but he really doesn't care about that. So I lipoed him. There, I got glands out, I got fat out, but we're doing a touch-up of the chest just about here. He's great here, he's great here. We're going to touch up the chest just in the lateral, get that even better hockey stick, and I'm going to add J-plasma, which I didn't have a year ago when I did his surgery, obviously on both sides. But now we're going to add on his entire abdomen, flanks, and back. So I'm going to go down to his groin, give him a six-pack, the midline, linea alba, the semilunaris over here. I'm going to mark them. You're going to see all that. Etch and inscribe the six-pack. Go back here. Get this out. Now it's fat, but it's loose skin. So, but we're going to lipo it, heat it up by the Vaser, and also use J-plasma to really define him well. This is the lateral blikes. I'm going to define that really well. Turn him around. We're going to get all this down to his butt, all this. But a lot of this is just kind of shortening as we get older, skin laxity, but there is some fat there. And I'm going to define his paraspinal muscles right over here. They're called the venous dimples. I want to give him that and really scoop them all around as much as I can possibly get. I want to give him an incision here, just above the butt crease. I want to give him an incision just about here so I can really get this nicely, because it's all about the skin tightening with him more than the lipo. So I'm going to get him here, come up front here, give him two incisions down by the groin, one by the belly button, and one each here by the nipple to get down and around and through. I will also maybe add one about here to etch the six-pack even better, and these scars heal up amazing, and they're stealth-like. So I'm going to mark them right now. The marking's pretty intricate, and it's very important to mark them correctly where you see the anatomy, and we're going to numb them and get going to the OR. So here are my markings, quite extensive. So let's start from the top. We're going to touch up the chest, tighten that even more up with the Vaser and with my J-plasma that I didn't have when he first did it a year ago. All of this. I'm going to etch the six-pack here, 2, 4, 6. Stealth incisions in the belly button. In the belly button, in the nipple, in the groin. I may add a little one right over here, not for the Vaser, for the lipo, to kind of etch these a little bit better, because I really want to define him well. That's what he wants. He wants the most definition that I can give him. The lateral blikes we're going to save, not much. I'm going to do some skin tightening there, but not much lipo there. Lipo, all of this, really get this out of here and lateral to the lateral blikes, to the lats back here. Moving on, this is where we need. There's the money shot right here. We need to get and tighten that all the way up. Give him an incision above the butt. Get the venous dimples here and this triangle right here, paraspinal muscles. And I'm going to also add one over here so I can really hit this area hard, because he's got fat, but not terrible amount of fat. It's just more loose skin that we need to tighten. And he doesn't want any skin excisions, but that leaves scars all the way around, and they're unacceptable to him in particular. So these are my markings. We've got to maintain these roadmaps and really get him to perfection. So we're going to numb these little areas, and off to the ore we're going to go. We pump you up.
Pump you up.
So what I'm doing now is I'm vasering, melting the fat, so it's a smooth liposuction thereafter. And then I'm also, with the energy, heating the undersurface of the skin. And that's going to help contract it. But I also have other devices to heat. Okay, so we vasered, melted the fat, tightened the skin. We're gonna do more tightening, but we did a good amount of vasering. Now we're lipoing. So from the belly button down, this space, there's no midline. So this should be just emptied. Just totally, completely emptied. All of this. Get down to the, it's not the fupa. Is it the fupa?
Fupa.
What?
Fupa.
Fupa.
Alright, so here what I'm doing now is inscribing the 6-pack. So, made a little incision here. 6-pack on top, 6-pack below. This one right here. This one right here. This one right here. A little curved cannula, so I'm gonna, the top of the 6-pack, which is a little curved. If you look at athletic bodies, the first 6-pack is a little curved. So I'm making this a little curved to go there. Etch that. And through the same hole, I can get this right in there without making another hole. So this is J plasma. This is helium gas with a radio frequency spark at the end. And this is my relatively new tool that I've had for 6 months. Get it underneath the skin. So now he's flipped around and I'm doing his lower back and his butt and the flanks. right, so we're liposuctioning. Yeah. We're lipo.
We're here to suck you out.
Getting the Venus dimples.
Sick.
The Venus dimples, the cute little Venus dimples. Dr. Lebowitz, Long Island, well, gynecomastia center, but I did his gynecomastia a touch-up from a previous surgery about a year ago, and he had the previous surgery, not by me, from a previous surgeon about 2 years ago, and we did a great job, but he looked great, and he wanted now his chest down to his belly. So I touched up his chest too, made a little incision here, and kind of scooped this out more. Then went down, did his entire belly, gave him a six-pack, 1, 2, 3, 4, 5, 6. The linea alba, the semilunaris here, stealth incisions in the groin and by the belly button. Added one more over here. Also went down to his back and did his lower back, upper buttock, flanks, and mid to lower back. Gave him those Venus dimples, as you saw. We really did great. I got 2,700, 2 liters, 700 out of him. And he wasn't fat to begin with. And if you can pinch this now, he's got absolutely no fat here. It's just paper thin, absolutely paper thin right there. And to the back, this is paper thin. This is not even an inch you can pinch. Not even an inch you can pinch. So it's perfect. I'm gonna dress him, get him out of here. So if you have gynecomastia, even if you want your body done, male-specific plastic surgery, call me, Dr. Lebowitz, 631-424-0101, 631-424-0101, or email me, jonathanleibowitz@gmail.com. Now make a muscle in your chest. Make a muscle. See, that is amazing right there. And suck in your belly. Do like a abdominal vacuum. And he's got a great shape there. And he's swollen because of the local. You want this, you call me, Dr. Lebowitz, 631-424-0101 if you want this.